Recent studies have shown that 1 in 4 individuals struggle with some form of mental health condition. What if we could make that 1 in 5, 1 in 10, 1 in 20? The stigma attached to reaching out for mental health services is so powerful that sometimes it just doesn't happen. Programs available through prevention and early intervention allow people to push through that stigma, to be brave, to have courage, to reach out for services that they may not have reached out for before. I'm Jason Austin. I'm a manager with Prevention and Intervention, and this video is here to show the kinds of services available through P&I.
This is the mission of the Prevention and Intervention Division, a part of the behavioral health system for the healthcare agency. To work in partnership with people early in the onset of a mental health condition, or to provide treatment and guidance with the goal of preventing an issue before it becomes a problem. Often, proper prevention can ease the burdens that behavioral issues place on individuals and families. To achieve these vital objectives, we have created programs to address the full spectrum of mental and behavioral challenges. The important goals we have set could not be achieved without proper planning and sufficient funding. In November of 2004, California voters approved Proposition 63, the Mental Health Services Act, which became law on January 1, 2005. Its goal was to reduce the long-term impact resulting from untreated, serious mental health conditions. Prevention and Intervention, or P&I, was created as part of the proposition itself to ensure prevention and early intervention programs were part of the continuum of care this act would eventually create. Here at Orange County Healthcare Agency Behavioral Health Services, more than 30 new programs have been created to help achieve the goals of the Mental Health Services Act.
In Orange County, around 2007-2008, we had an extensive community planning process where we invited people from all over the county, from different service providers, and we basically did a needs assessment. We determined what would be the most helpful to the residents, the unique residents of Orange County. And so from this process, we came up with, we developed our original PEI plan, which had 8 project areas and 33 programs. And then so we put together this plan, and it was approved by the Department of Mental Health in 2009.
Today, P&I has 4 categories encompassing more than 30 programs. Prevention involves the early recognition of serious mental health conditions by improving access to care and by reducing the stigma and discrimination against people with a mental health condition. Prevention and intervention programs are not just for education and support, but also for recovery, relapse prevention, and helping participants achieve the best outcomes possible. Early intervention can be vital in improving the chances of successful treatment, but many who need services do not seek help. That makes outreach one of the most essential parts of what we do. Our P&I programs fall under 4 categories: community-focused, school-focused, system enhancement, and navigation. Community-focused efforts include support service programs for parents, children, families, and veterans, as well as a crisis prevention hotline. You'll find us in Orange County schools as well. From children entering kindergarten to veterans returning to college, P&I provides behavioral health intervention and support services to boost coping skills and stress management. System enhancement deals with making our diverse programs more integrated and more efficient. Our navigation services assist the community in accessing needed behavioral health services and understanding the continuum of care within the HCA system. With so many programs and resources available, we needed an efficient way to let people know how to find the information and assistance they need. One of P&I's most visible navigation programs is also one of its newest. OC Links is the county's information referral line that provides telephone and online support for anyone seeking information about the county's mental health, drug, and alcohol services. For anyone who needs support in linking to any of HCA's behavioral health programs, it's just a phone call or click away. We are the people behind the Prevention and Intervention Division. Together we can support those facing mental health challenges, making Orange County a healthier and happier place to live for families, parents, kids, individuals, and those who love them.
And so my job every day, I get to go home with a smile and realizing that maybe I changed somebody's life just a little bit, and in return, my life has changed.
We're making an impact, a huge impact.
I think it's very rewarding. It's a very rewarding job, and I like my job.
We get a front row seat to their achievements, to their accomplishments, to their progress. That can be truly rewarding, and it makes tougher days much more manageable.
I love my work. I really love what I do.
Watching them just move in a direction of change is huge for us.
It's really exciting to be a part of that process and see the outcome in the community.
You can see that person grow in ways that you never thought they could.
I think that our staff get to see that they do good every day. And that's, I think, my favorite part of working for this program.
This video is brought to you by BHS Navigation.